this patient came to see me for a consultation regarding teeth number 3 and 4 in 2016, so 8 years ago. Her chief complaint was that she had some tenderness on the upper right side after she had received a couple of fillings on the upper right side and the lower right side. At the time, patient denied any temperature sensitivity or pain to biting. But she did complain of some pain that would happen after she would eat, and then the pain would go away. So we examined all the upper right and lower right side teeth at that time in 2016. And they all responded within normal limits to percussion, palpation, biting, cold. And here's the date, as you can see, 2016, so 8 years ago. What I noticed was that it looked like there was a food trap. As you can see, there's some bone loss between teeth number 3 and 4 and 2 and 3 here. And the fact that patient mentioned something about the pain would appear after she would eat gave me the impression that perhaps maybe we're dealing with food compaction and perhaps maybe gingival irritation. And because everything responded within normal limits to all my tests, upper right and lower right side, I did not recommend root canal treatment. I said, let's just give things a little more time. Let's see what develops. And patient happily agreed. Well, she came to see me today for consultation regarding the upper right side. And take a look. Here's the upper right side. And look what happened here. So according to the patient, in 2021, so 3 years ago, a traveling dentist who comes to her dentist's office once a month to do the root canals, did these 2 root canals for her. So 3 years ago, a traveling endodontist did these root canals. And as you can see now, tooth number 4 is involved. Number 3, within normal limits to percussion palpation, and as you can see, radiographs do not show a periapical radiolucency associated with tooth number 3. Number 4 was tender to percussion and palpation. And let's go and probe the tooth. Remember, you always probe the tooth. So let's go ahead and probe it. All right, so let's walk the probe. And as you walk the probe, it goes in. It goes in to 9 millimeters right here. As you can see, 9, 10 millimeters. All right, so as you saw, unfortunately, tooth number 4 has a vertical root fracture, and you can see the J-shaped radiolucency that is associated with the tooth. All right, so to me, it seems like the endodontist wasn't sure in 2021, that traveling endodontist wasn't sure in 2021 which tooth was the problem. Remember, I recommended us to wait, give things some time. And then patient disappeared. And then she shows up like this today. And I'm thinking in 2021, that traveling endodontist wasn't sure either which tooth it was. Did root canal on tooth number 3, but tooth number 3 was never an issue. It was always tooth number 4. And then patient probably went back and complained of some symptoms. And then the endodontist said, okay, all right, let's just go ahead and do a root canal on tooth number 4 now and see what happens. And did a root canal on tooth number 4, and you know the rest. So remember what I always tell you, sometimes no treatment is the best treatment. Anyways, it is what it is now. And so unfortunately, tooth number 4 needs to be extracted. So I referred the patient back to her dentist to have tooth number 4 extracted.